will continue to provide pay rises for NHS workers, as the Chancellor set out at the spending review. This follows the multi-year pay deals, which over 1 million NHS staff have benefited from, including a pay rise of over 12% for newly qualified nurses. Mr. Speaker, we're also ramping up our investment in our NHS with a £6.2 billion increase for 21-22 as part of our £34 billion commitment by 2024-25 and £3 billion for supporting recovery and reducing waiting lists. As part of this, we are increasing the number of staff in the NHS with over 6,500 more doctors, almost 10,600 more nurses, and over 18,700 more health support workers in the NHS now than a year ago. And we're on track to have 50,000 more nurses in the NHS by the end of the Parliament. Mr. Speaker, last week we submitted our evidence to the NHS pay review bodies. These are independent advisory bodies made up of industry experts. Their recommendations are based on an assessment of evidence from a range of stakeholders, including trade unions. They will report their recommendations in the late spring, and we will carefully consider their recommendations when we receive them. I can assure the House that we're committed to the NHS and to the amazing people who work in it, because just as they have been so vital throughout this pandemic, they will continue to be the very essence of our health service, together with all those who work in social care as we come through this pandemic and build our health and care system for the future.
Jonathan Ashworth.
Grateful for the Minister, but where is the Secretary of State, Mr. Speaker? Why isn't the Secretary of State here to defend a budget that puts up tax for hard-working families and cuts pay for hard-working nurses? The Secretary of State has stood at that dispatch box repeatedly, waxing lyrical, describing NHS staff as heroes, saying they are the very best of us, and now he is cutting nurses' pay. Last summer, when asked by Andrew Marr if nurses deserved a real terms pay rise, he replied, "Well, of course, I want to see people properly rewarded. Absolutely." And yet now he is cutting nurses' pay. Last year, he brought to this House legislation to put into law the NHS long-term plan. He said from that dispatch box that his legislation represented certainty for the NHS about a minimum funding level over the next 4 years and certainty for the 1.4 million colleagues who work in our health service. That long-term plan was based on a 2.1% pay increase for all NHS staff. Every Tory MP voted for it. The Minister voted for it. And now every Tory MP is cutting nurses' pay. Now, and by the way, she talks about the budget. Where is the Chancellor? Where's his glossy tweets? Where's his video? Why didn't he mention it in the budget that he was cutting nurses' pay? Why did he sneak it out the day before in the small print? And this, Mr. Speaker, is at a time when our NHS staff are more pressured than ever before. In the midst of the biggest health crisis for a century, when there are 100,000 shortages, what does she think this will do to the vacancy rates to be cutting the pay of NHS staff? Perhaps she can tell us. And she talks about the pay review body, but she didn't guarantee that they will implement any real terms pay rise that the pay review body recommends. And why is that? Because ministers have already made up their minds, and that is to cut in real terms NHS pay in a pandemic. Our NHS staff deserve so much better, Mr. Speaker. If this government doesn't deliver a pay rise, it shows once again that you simply can't trust the Tories with the NHS.
Minister.
Well, thank you, and I thank the Shadow Secretary of State for his welcome to me this afternoon. I would actually say that I wonder why this International Women's Day, it's a shame that he hasn't got a female colleague at the dispatch box on his side this afternoon. I would also...
I think we're just getting it back into reality. I don't think we need the personal slights at each other. I totally agree. Minister.
Shall the Secretary of State is entitled...
Sorry? The Shadow Secretary of State is entitled to ask for an urgent question. I've granted it. I don't need, because you're questioning me, not the Shadow Secretary of State. Minister.
My apologies, Mr. Speaker. And actually, I want to say that I don't think we should play politics with these very serious questions as we come through a pandemic that has hit us and the world so hard, when people have lost their lives, when people have lost their jobs, and when we as a government have had to spend so much to support the economy and individuals and indeed the NHS through this pandemic. And I've been speaking to staff at the Frontline Health and Social Care throughout this whole pandemic, and I can say I and we the government are grateful to them for what they have done and are still doing from the bottom of our hearts. But while so much of the public sector is having a pay freeze, NHS staff will get a pay rise. In these difficult times, the government has submitted its evidence to the pay review bodies, and as I said in my opening statement, those pay review bodies will report back to us. The pay review bodies will look at a wide range of evidence, including, for instance, evidence from the trade unions, the situation of inflation, and also the wider situation with the economy and pay levels, and they will report back, and we will of course look at their recommendations very carefully. I will also say to him, because he was talking about the vote that we had on the NHS Funding Act, which absolutely we voted for. Yes, we voted for, and we are fulfilling our commitments to the record investment in the NHS, £34 billion more. He also refers to the long-term plan, which is not something we voted for, but indeed he refers to the figure in that, which is the 2.1% that would be invested in the NHS workforce this year, and we will invest that. That will include not only these pay rises for the NHS, also pay progression and further investment in the NHS workforce. We will continue to invest in more doctors and more nurses for the NHS, and I wish he will welcome that. And I will say we will continue to support the recovery of our economy, restore our public finances so that we can fund our NHS not just through this pandemic, but also into the future.
Let's go to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. The long-term plan had a 2.1% increase in salaries budgeted for, which has now gone down to 1%. But an even bigger gap in last week's budget was identified by the OBR as a lack of funding from next year for annual COVID vaccinations, for test and trace, for long COVID, and for millions of catch-up operations delayed by the pandemic. What discussions has the Health Secretary had with the Chancellor about this gap in funding, and where is that money going to come from?
Minister.
Thank you, Mr. Speaker, and I thank my right honourable friend for the question. He also mentioned the 2.1% that was in the long-term plan. So what I say is that figure covers not only this pay rise that we're discussing for the NHS workforce, but also the pay deals that have been agreed for staff who are on other multi-year pay deals, on pay progression that will happen, and also other investment in the workforce. Then coming to his question about funding for broader extra COVID costs, that's not in the main NHS budget. And just as we had 63 billion invested in those costs through this year that we're in, there is an extra 22 billion set aside for COVID costs outside the NHS budget, and also 3 billion specifically for recovery and bringing down waiting lists.
Let's go to SNP spokesperson, Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. The proposal for a mere 1% pay rise suggests this government doesn't value the risks taken and sacrifices made by health and care staff throughout the pandemic, nor the challenge they will face to clear the backlog. Like their initial refusal to extend free school meals, it also shows the government are out of touch with the public. With a workforce crisis before the pandemic, does the Minister really believe such a mean award will help recruit and retain healthcare staff? Senior Band 5 nurses in England already earn up to £1,000 less than their Scottish counterparts, while the removal of the nursing bursary and imposition of tuition fees has saddled recently qualified nurses with up to £50,000 of debt. I'm sure she knows that shops don't accept claps instead of cash. So will this government not give health and social care staff a decent pay rise and consider a one-off thank you payment, as in Scotland?
Minister.
Thank you, Mr. Speaker. Well, I'm somewhat surprised by the Honourable Lady suggesting the language used around 1%, because in fact a 1% pay rise for this large number of staff will cost around £750 million. And this all has to be paid for, and this in the context you should remember that very sadly many people have lost their jobs. Around £750 million people have lost their jobs through the pandemic. Others are seeing pay cuts, reduced hours. We're in a time of huge economic uncertainty, and while much of the public sector is going to have a pay freeze, by contrast the NHS workforce are going to have a pay rise.
Let's go to Peter Gibson. Peter.
Thank you, Mr. Speaker. I acknowledge the very difficult decisions the government has had to take as a result of the pandemic, meaning that the majority of public sector salaries are to be frozen this year. Could my honourable friend confirm that our amazing NHS staff are the exception to this, which in part acknowledges their hard work, and what we should now do is await the outcome of the peer review bodies?
Minister.
My honourable friend is absolutely right. So the NHS workforce are the exception to the pay freeze for the wider public sector, recognising the huge amount of work, the lengths they have gone to look after us all during COVID. And he's absolutely right. We will also wait for the response from the independent pay review bodies before we announce the pay settlement.
Let's go to Munira Wilson. Munira.
Test and trace programme, which SAGE considers has only had a marginal impact on COVID-19 transmission, will have had an almost 150% increase on its original £15 billion price tag following the small print buried in the Chancellor's budget last week. So is this government's claim that the 1% pay offer to NHS staff is all they can afford actually serious?
Minister.
Well, I would say to her firstly that the test and trace programme actually are doing a truly phenomenal job. And the other thing I would say to her is in this pandemic, what we absolutely need is an effective test and trace programme. So I make no apologies for the fact that we are making sure it is funded.
Thank you, Mr. Speaker. Could I ask the Minister, although everyone in this chamber would really like to give nurses a decent pay rise as much as possible, could I ask the Minister how this equates with equivalent grades in the police, the fire service and the armed forces, particularly as the Minister has already mentioned, they're on a pay freeze at the moment?
Minister.
Well, as my honourable friend says, that most of the public sector, and that includes the police, are regrettably in a pay freeze the coming year because of the challenging times we find ourselves in, and recognising that across the economy there are people who've lost their jobs and we're having to spend a huge amount of money to support people's incomes. And it's against that backdrop that we are giving NHS staff a pay rise. But indeed, these are difficult times that we're living through.
Let's go to Jim Shannon. Jim.
Thank you, Mr. Speaker. I've received literally hundreds of emails from constituents and from the Royal College of Nursing. Myself and my party, the Democratic Unionist Party, support the campaign for a fair wage increase for NHS staff because they've been at the forefront of the war against COVID-19. They put their lives on the line day by day in defence of this great nation, the United Kingdom of Great Britain and Northern Ireland. Since 2010, the average weekly pay in the private sector has grown by 22%, compared to just only 17% in the public sector. So, Minister, I say very gently and very kindly, would the Minister, in the name of justice and moral reasons, consider and review the decision and deliver for NH staff? Thank you.
Minister.
Thank the honourable member. I mean, what I will say is that the government has submitted its evidence to the pay review body of what we can afford for NHS pay, but the review bodies will look at a wide range of evidence on what is the right level to set and will make us recommendations later this spring.
Andrew Percy.
Thank you, Mr. Speaker. I'm proud to play a small role on the NHS Frontline, and This most recent wave has been particularly brutal on nurses, healthcare assistants, and especially this time round, ambulance crews. So can I urge her to, during this period of the review body considering it, open up discussions with the Treasury to look at what more we can do for our NHS staff, be that a one-off additional payment, be it other support, just giving people more rest and recuperation time, and we should do everything we can and make every effort to go further than what has so far been recommended.
Minister.
I thank my honourable friend. I know that he does tremendous work himself at the Frontline. And he also makes a really important point that beyond the question of pay, it's really important what other support are we giving to the NHS workforce. As we have done through the pandemic, there's been lots of extra support for the workforce, whether it's with practicalities like hot food and drink and things that just make work and long hours more manageable, but also the mental health support, which is so crucial for those who have experienced some really traumatic experiences, and we are absolutely looking at what continued support we can put in place in the months ahead.
Let's go to Maria Riedel. Maria.
Thank you, Mr. Speaker. NHS staff feel betrayed by this government on pay. In July, the Secretary of State, who really ought to be in the chamber today answering for his responsibilities, answering this UQ, he said the following. He said, "We absolutely want to reward NHS staff for doing what they've done." That's what he said. So can the Minister tell me how on earth delivering a real terms pay cut meets that very clear promise from the Secretary of State?
Minister.
Thank you, Mr. Speaker. As I would say, that this discussion is against the backdrop of many people receiving pay cuts in parts of our economy, people losing their jobs, and a wider pay freeze in the public sector. Against that backdrop, we recognise the enormous work that the NHS workforce has done, and that is why the workforce for the NHS is exempt from the pay freeze and will be getting a pay rise.
Thank you, Mr. Speaker. Could I thank the Chancellor for the scale of economic intervention that he has provided both businesses and livelihoods in these unprecedented times, and join others in paying tribute to our incredible NHS. The nation owes a debt of gratitude to what they have done and what they continue to do. I understand no decision on NHS pay will be made until May. Could I ask the Minister to wait for and heed the advice of the independent review body before confirming the scale of the pay rise NHS staff can expect?
Minister.
I thank my honourable friend, and absolutely so we submitted our evidence to the pay review body last week, which included the sort of affordable pay envelope from the government, but those pay review bodies will be looking at a wide range of evidence, and we will look at their response when they come back to us.
Let's go to Barbara Keeley. Barbara.
Thank you, Mr. Speaker. Now, this pay proposal for NHS staff has managed to be both wrong and unpopular. Over 2/3 of those surveyed, including nearly 60% of Conservative voters, think that a 1% pay rise is less than our NHS staff deserve. And I do believe the Secretary of State should be in the chamber answering this urgent question about it. But can the Minister tell us whether she agrees that NHS staff are worth a real terms pay increase? And does she consider that the billions wasted on ineffective or undelivered PPE could have been better spent giving our NHS heroes a pay rise?
Minister.
Thank you, Mr. Speaker. It is absolutely right that we invested in making sure that we could supply PPE to the NHS and indeed to the social care workforce during this extremely challenging time of the pandemic, when there was a period when there was a real global shortage of PPE. So it's absolutely right that we spent money on that. And in this right now, as we are looking ahead at the pay deal for the next year, it's absolutely right that we are exempting NHS staff from the wider pay freeze for the public sector and make sure they get the recognition that they deserve for what they have done and are still doing.
Let's go to Bob Blackman. Bob.
Thank you very much, Mr. Speaker, and I thank my honourable friend for the answers she's given thus far. Clearly, we all have to await the results of the independent pay review body, but could she explain to the House the basis on which the government put forward the proposal of 1%, and also how that compares to the commitments that were made to dramatically increase the salaries, particularly for nurses at the start of their careers?
Minister.
Yes, so we have delivered on the commitments in the multi-year pay deal for what's called Agenda for Change staff, which includes nurses, and that includes the 12% pay rise for newly qualified nurses, bringing the starting salary for a new nurse to almost £25,000. We're now going into a new pay settlement for the forthcoming year, and it was as part of the spending review. The budget was set the envelope to cover pay costs for this pay settlement, but also clearly there's extra pay costs for the growing numbers of staff as we're increasing our staff in the NHS, particularly nurses. I've said on track to have 50,000 more nurses in the NHS by the end of this Parliament.
Let's go to Jack Dromey. Jack.
Mr. Speaker, together with the Right Honourable Member for Hodge Hill, I met with nurses, members of the Royal College of Nursing in the West Midlands. Catherine, a young intensive care nurse, told with tears in her eyes how she had worked for months to save lives. She told of how she went off for a week's holiday because she was exhausted. She came back, 3 of the 4 people she'd been caring for had died. A member of staff had died. Does the Minister not begin to understand the dismay and despair on the part of tens of thousands of nurses like Catherine, that having endured purgatory to save lives, their reward now is effectively a pay cut?
Minister.
Well, I mean, I disagree with the honourable member on what he just said, and I said we are committed to giving NHS staff a pay rise. But he actually made a really important point when he talked about Catherine and like other frontline staff who have been through incredibly difficult times. I speak to nurses and other healthcare workers all the time, and one of the things I've heard many times in recent weeks and months is how badly staff need time off. And many staff haven't been able to take holiday because they have been putting extra hours in to help with the pandemic response. And one thing that is absolutely vital in the weeks and months ahead actually is that staff get the annual leave that they need in order to rest and recuperate. And that is one of the things I'm working with the NHS to make sure happens.
Richard Fuller.
Mr. Speaker, hundreds of thousands of people have lost their job during this pandemic and be looking to the government to support them so they can start earning again for their families. Millions of people in this country are on furlough and are living with pay cuts of 10% or 20%, and will be looking to the government to continue to support their businesses through extension of the furlough programme. And thousands of small businesses have seen the value of their businesses evaporate over the last 12 months, and we're looking to the government to support the economy to rebuild their businesses. So will my honourable friend remind us that it is the government's job to balance all of those calls on the taxpayer, and it is the job of the pay review body to come back with a recommendation.
Minister.
My honourable friend is absolutely right that so many businesses have been so hard hit by the pandemic. It's vital that we support not only the livelihoods of individuals who work in those businesses that have been hit, but also those businesses themselves, because they are what will help us come through this and recover from the economic pain of the pandemic. And he's right that the government is having to balance these enormous demands on the public finances. We also need to take steps to get ourselves to recover those finances so that we have a strong economy for the future.
Let's go to Jeremy Corbyn. Jeremy.
Thank you, Mr. Speaker. Does the Minister realise there's a sense of the most enormous anger all across the country? Nurses have seen us through this crisis, have saved many lives, yet they are offered a pay cut as a result of it. Some are already having to resort to food banks to survive, and a third are thinking of leaving the profession unless they get a decent pay rise. Surely to goodness, if 37 billion can be found to pay Serco for a failed track and trace system, surely the money must be available to pay NHS staff properly. You can't clap for them, then cut their pay at the same time. Surely we should just pay them properly so that we can have a national health service that we can all be proud of and all rely on for all time in the future.
Minister.
Well, actually, talking of anger, I think one thing that is not very helpful is probably for many of those on the benches opposite to be fueling a level of anger by calling a pay rise a pay cut. And what we're being absolutely clear about is that NHS staff are getting a pay rise. What I will also say to him is that we need both an NHS test and trace system to control the virus, and we need NHS staff.
Dr. Ben Spencer.
Thank you, Mr. Speaker. I draw the House's attention to my register of interests and additionally that my wife works in the NHS. NHS staff pay is and always will be a highly contentious issue. It was during the junior doctor contract debate, and you don't need back end of a pandemic for it to be so at the moment. And it results because of the mere existence of national pay contracts, pay awards and review bodies. As part of the implementation of the changes proposed in the future of Health and Care White Paper, would my honourable friend review alternate models allowing decisions around individual staff pay to be set by local employers such as NHS trusts themselves so that they can be best suited to the employees and the services that they work for?
Minister.
I thank my honourable friend. He makes a really important point. And I know actually this has been a point of much debate over the years about the balance between nationally set pay and local pay, and there are pros and cons of doing it both ways. So you don't want to have trusts competing directly all the time for workforce, but on the other hand, there are higher costs of living, for instance, in some areas. And actually that's why there is some flexibility in the system for different levels of pay according to some different areas, as he will well know, and also some extra support in areas where it's hard to retain staff. But of course, I'll continue to always listen to his expertise, which I really value.
John.
Thank you, Mr. Speaker. Earlier this year, Baroness Harding defended giving £1,000 per day to private sector consultants on the failing test and trace programme. Now the Minister says we cannot afford to give our NHS heroes a real terms pay rise. But given that COVID will be with us for years to come, given the outstanding non-COVID backlog in treatment, given the incredible pressure on NHS staff, the existing 100,000 NHS vacancies and the resulting reliance on expensive agency staff, can we really afford not to?
Minister.
Well, I mean, firstly, what I will say against the situation she talked about in the NHS workforce is one of the fabulous things we've seen through the pandemic, and I'm really grateful to all those who work in the NHS for this, is a reduction in the leaver rate. So more people staying and sticking with the NHS, which is truly phenomenal. And we have to make sure we look after those people. I talked earlier about some of the support for the NHS workforce as we recover. It's also fabulous to see such an extra increase in NHS workforce, in careers in the NHS. For instance, over a third more people applying to become nursing students this year compared to last year. But I also want to make this point on the test and trace question. It's not an either test and trace or the NHS workforce here. We need to have a test and trace system and, of course, pay our NHS workforce.
Sarah Butler.
Thank you, Mr. Speaker. I've had several bits of correspondence about the NHS pay over the weekend. Can my right honourable friend confirm if any decision has been made specifically about nurses' pay, what the total allocation for NHS pay rises is in the budget, and will she ensure that those on lower pay bands are prioritised in any pay awards?
Minister.
I thank my honourable friend very much for the question. One thing I should just say is that nurses are just part of the workforce being considered in this pay review, which involves over 1 million staff, but around 300,000 of those are nurses. The cost of a 1% pay rise is in the order of about £750 million. But we were absolutely going to look at the recommendations we get through from the pay review bodies when they come through later in the spring.
Let's go to Julie Elliott. Julie.
Thank you, Mr. Speaker. The Minister has today said that she is grateful to NHS staff for their hard work during this pandemic. Yet the reward this government has suggested is a real terms pay cut. Does the Minister feel this is the right response, both morally and economically?
Minister.
Well, firstly, let me say to her that we have said in our submission to the pay review bodies that we are funding, we have a funding envelope to enable a 1% pay rise for NHS staff. And I will also say to her, as I've said to others, that the pay review bodies will look at a wide range of evidence, and one of the factors they will look at is inflation. They'll also look at what's happening to pay levels across the economy.
Let's go to Robert Halford. Robert.
Thank you, Mr. Speaker. My honourable friend will be aware of the heroic efforts made by NHS staff at the Princess Alexandra Hospital and across Harlow during the pandemic, who put their health and lives at risk looking after Harlow residents during the pandemic. Whilst absolutely recognising the economic constraints and the £2 trillion debt that our country owes, will she reconsider and at least propose a larger increase for lower paid NHS workers?
Minister.
Well, I mean, I completely agree with my right honourable friend about the heroic efforts of NHS staff at hospitals, in primary care and community trusts across the country, including the Princess Alexandra Hospital that he mentions. As I've said, we've submitted the pay review body our envelope for funding the 1% the government says it can afford, and we will be looking at their recommendations when they come back. One thing I should also say is that for lower paid workforce, there was a commitment in the spending review to make sure lower paid staff would at least get a £250 pay rise, and that applies to those in the NHS as well.
Steve Bryan.
Thank you, Mr. Speaker. We've heard this weekend about nurses in particular wishing to leave the profession. So does the Minister have any figures on departures in recent years? And would she agree that the elephant in the room here is not pay across the board, but low pay in the NHS? And even a 10% pay rise on not very much is not very much. Don't we really need a grown-up conversation about what we pay those who do some of the least glamorous jobs across health and social care, day in, day out, every single year?
Minister.
Thank you, Mr. Speaker. I mean, one thing he's absolutely right is that we should be thinking about the whole workforce in this. I mean, I know that as the Minister with Oversight for Social Care as well, that I have many conversations with that sector about the pay levels for people working in social care. And I will say, I want to see us appropriately rewarding and recognising staff across our whole health and social care system, and that's not only actually in pay terms but also in the wider package of support that people get, and making sure that their jobs and each day at work is a good day, and that's something I will continue to work on in this role.
Let's go to Clive Efford. Clive.
Thank you, Mr. Speaker. It hasn't taken the Conservatives long to revert to type and forget the contribution that our NHS staff have made to fighting this pandemic over the last year. Since 2010, Agenda for Change staff have seen their pay cut in excess of 10% on most of the spinal points on the spinal column. So can the Senate Minister say what assessments she's made of the retention and the attraction of high quality staff into the NHS that this pay increase will have? Surely we need to attract these people into the NHS, and this will not do it.
Minister.
Yeah, he makes a really important point about the retention of staff. I'm working to make sure that we have another 50,000 nurses in the NHS by the end of this Parliament. On the one hand, that's making sure that we have more newly qualified nurses graduating from nursing degrees. On the other hand, it's making sure we keep the nurses and the other NHS workforce that we have. We are seeing, and we have seen, an improvement in retention, but I want that to continue to be maintained. That's why I'm working with NHS England on making sure we have the greatest possible package of support, including mental health support for staff who've been through a really tough time.
Let's go to Gagan Mahindra. Gavin.
Thank you, Mr. Speaker. Can I firstly wish the House a happy Commonwealth and International Women's Day? Can my honourable friend outline how many pay rises we expect to see through pay progression by raising up pay bands?
Minister.
I thank my honourable friend for the question. He's absolutely right that in addition to the pay settlement that we'll reach through this pay review process. There are also many staff who will be eligible for pay progression. That's about 40% of the staff we're talking about are eligible for pay progression. So many of those we will see will get a pay rise in addition to the figure that we get to through this process.
Let's go to Paul Blomfield. Paul.
Thank you, Mr. Speaker. The Minister was right when she talked about the amazing people who work in the NHS who have, in her words, gone the extra miles for the country. So does she understand why they'll see this real terms pay cut as a kick in the teeth? She justified it by reference to the pay freeze for other key workers. But that was a decision of this government. So shouldn't they recognise they've got it wrong on both counts, review the pay freeze and give NHS staff the pay rise they deserve?
Minister.
I think I will have to remind the honourable gentleman of the difficult times that we are living in, the many thousands of people who have sadly lost their jobs through COVID, others who've had pay cuts. We're in times of great economic uncertainty. It's against that backdrop that the government has to make very difficult decisions. It's against that backdrop that the government has made the decision that there will be a pay freeze for much of the public sector, but exempted those on the lowest pay and the NHS from that pay freeze so that the NHS workforce will get a pay rise.
Let's go to Kevin Hollinwright. Kevin.
Thank you, Mr. Speaker. On the basis that every 1% increase will cost the taxpayer £750 million, I didn't hear the Shadow Health Secretary say how much he would increase pay by, or indeed which taxes he would increase to pay for it. But would my honourable friend agree that one way to increase resources for health and social care and remuneration of our care workers is by means of a German-style social care premium?
Minister.
Well, I thank my honourable friend for his question, and I'm smiling because it's not the first time that he has mentioned to me a German-style social care system, and I absolutely appreciate the work that he's done to look into this. And I say to him, as I've said to him before, that we will bring forward proposals for social care reform, but he's absolutely right also that we need to look at the whole health and social care system as we consider these difficult questions.
Bentley.
Mr. Speaker, the efforts of NHS staff during the pandemic have been nothing short of heroic, and although deserved, recognition and goodwill are no substitute for a proper pay and investment. Given the current level of vacancies and the fact the use of agency staff in Welsh health boards costs nearly £70 million a year, would the Minister not agree that a substantial pay award would not only be fair, it would also constitute an investment in the NHS workforce that could help recruitment and retention of staff and thereby reduce the reliance on agency staff?
Minister.
Well, actually, I'm absolutely committed to increasing the NHS workforce. As I mentioned in my opening statement, we've already got more than 10,000 more nurses than a year ago, 6,500 more doctors and over 18,000 more health support workers. We saw fantastic growth of the number of students starting nursing degrees last autumn, nearly 30,000, and nearly 50,000 have applied to study nursing this autumn. So I'm absolutely determined that we will continue to increase the size of our NHS workforce to meet the needs of the population for healthcare.
Let's go to Dr. Jamie Wallace. Jamie.
Thank you, Mr. Speaker. Can I thank the Minister for the answers she's given today? But could she set out in more detail the process of the pay review body, please?
Minister.
Absolutely. Yes. Firstly, the process begins with Secretary of State sending the pay review body a letter to set out their remit, which was done in December. Then we have submitted our evidence to the pay review body last week, which covered this point about the pay envelope, but also a whole load of information about, for instance, retention and staff levels and support for the workforce and other things. They will consider this amongst other evidence from the NHS, from trade unions and others, and then they will report back to us in late spring, and we will carefully consider their recommendations and come to a decision.
Let's go to Debbie Abrahams. Debbie.
Thank you, Mr. Speaker. Mr. Speaker, by the end of the year, £37 billion of taxpayers' money will have been spent on the Serco Test and Trace programme, which isn't even fit for purpose. This is on top of the government spending £10 billion more on PPE contracts than they should have. So with this waste, how does the government justify that most of the 300,000 NHS nurses are only worth a £250 a year pay rise?
Minister.
Thank you, Mr. Speaker. Well, I will say, so the pay conversation that we're having at the moment is indeed about nurses who are a fabulous part of our NHS workforce, and I can't thank them enough, but also for the wider NHS workforce, which includes paramedics, health support workers. This pay settlement will also include some doctors. So it's over 1 million staff who are being considered in this process, and that's why the cost is closer to £1 billion than the figure she mentioned. It's around 750 million. But what I will say is actually the government was absolutely right to invest in PPE to protect staff in health and social care during the pandemic at a time when there was a global shortage of PPE, and we're absolutely right to invest in a world-beating test and trace service, which is doing a phenomenal job and is essential to our country's recovery from this pandemic.
Right, let us go to the final question from Nigel Mills. Nigel.
Thank you, Mr. Speaker. Could the Minister confirm that the public sector pay review body can take into account the exceptional service and sacrifice we've had from our nurses and medical staff over the last year? And if they do recommend a higher pay rise than the 1%, then the government will look at funding that from new resources and not have to scrimp and save for other savings in the NHS to fund the difference.
Minister.
Thank you, Mr. Speaker. Well, I agree. Our NHS, in fact, our whole health and social care workforce have done a phenomenal job through the pandemic and continue to do so. We shouldn't forget that. I won't preempt the recommendations that we will receive from the pay review body, but I assure my honourable friend we will absolutely consider them carefully before coming to a decision.
I am now suspending the House for three minutes to enable the necessary arrangements for the next business to be made. Order.